Hey everyone, we've got another heart today. This is number 1532 in our collection. The heart would have sat roughly in the chest like this, with the anterior surface coming out towards the screen, the posterior surface towards the turntable. Legs are inferior here, head or superior here, left over here, right over here. Now let's start off as we always do, which is by trying to identify the right atrial appendage, at least externally. And here's an atrial appendage that appears to be broad-based, pyramidal, or triangular in shape, consistent with a morphologic right atrial appendage. And then here, just to point out, we've got a finger-like, smaller left atrial appendage, or I should say an atrial appendage that appears, at least externally, to be consistent with the morphologic left atrial appendage. So why don't we go ahead and open up what we think is the right atrial appendage. And we immediately see that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. And what's immediately striking is that there really isn't an atrial septum, and there appears to be really what is a common atrium. So this would be the left atrium, which does appear a little smaller than the right-sided component, but here's the left atrium, here's the right atrium, and so really a common atrium. We do see the mouth of the coronary sinus here. And then we can also see from the atrium if we're able to find the orifice to the left atrial appendage, and that appears to be here. And as we advance our probe, we do in fact see it here in the left atrial appendage. So we are dealing with a common atrium with the right atrium here and the left atrium more posteriorly. And when we look at this left atrium, there appears to be no egress other than into the right-sided component of this common atrium. When we look at this common atrioventricular valve then, it does appear a little rolled and thickened and dysplastic. And it appears to open up into what appears to be a morphologic left ventricle. And here you can see fine crisscross trabeculations. So it does appear that we're dealing with double inlet left ventricle and a common atrioventricular valve and a common atrium. So if this is the left ventricle, it appears that this would be the morphologic right ventricle. And you can see how hypoplastic this is. And when we try to put this heart together here, this appears to be the right ventricular cavity from which arises what appears to be the aorta. So here's the ascending aorta, the transverse aorta, and then the descending aorta posteriorly. So we have a small anterior and right-sided right ventricle that gives rise to the aorta. Here is a 3-leaflet aortic valve with 3 sinuses. Here's 1, 2, 3 leaflets, and then 1, 2, 3 sinuses. And you can see within these 2 sinuses, here and here, arise the coronary arteries. And then there is a ventricular septal defect here that lives immediately underneath the aortic valve here, and otherwise seems to have entirely muscular borders, except for the superior margin, which is formed really by this aortic valve leaflet. So far we have common atrium with a common atrioventricular valve with double inlet left ventricle, a hypoplastic right-sided anterior right ventricle with discordant ventricular arterial connections. But let's go back into the left ventricle. And there's the atrioventricular valve here. And let's try to find the second outflow tract. And here we find an arterial valve that has 3 leaflets, 1, 2, 3, with 3 sinuses. But clearly you can see that this valve is much smaller than the aortic valve here. This, in fact, is the pulmonary valve. So once again, here's one leaflet, two leaflets, three leaflets. Here's the left pulmonary artery, and then the right pulmonary artery would have dove back here. And then here, once again, is the left atrial appendage. Once again, to take a look at the small RV cavity, once again, here's the small right ventricle. Here's this VSD that then leads into this morphologic left ventricle. There is a common atrium as well, which has one egress, which is through this common atrioventricular valve. So a double inlet left ventricle with discordant ventriculo-arterial connections